I brought a motion today to the full council meeting calling on the HSE to develop and support the development of additional dementia care capacity within County Clare and indeed within the wider Midwestern region. As we know, dementia is becoming one of the most prevalent illnesses, especially amongst those over the age of 75 and in our elderly population. And as we look to the future, our population is growing, our average population age is increasing, so the prevalence of dementia is projected to double by 2050. So at the moment there's about between 15 and 1700 people estimated in County Clare that are suffering from dementia, and at the moment we don't have the adequate dementia-specific care beds available for those who are in need of them. As we know, putting an elderly relative into a nursing home is one of the most difficult decisions that a family will ever make, and it's even more difficult when you know you're putting them into a residential placement that's not actually designed really for their needs. So I put down a motion hoping that we would see some plan of action from the HSE to develop additional capacity in this space. I'm dealing with one case locally, and I obviously won't name names, but this elderly resident has been passed from St John's to Nenagh, back to St John's and back to Nenagh again, all while waiting for a proper space within a dementia care unit in the county that's accessible to the family and that meets the needs of the resident. So that's why I brought it forward. I think it's important to highlight the issue, and as we look to the future with the development of or the growth, should I say, of our population and the increased prevalence of dementia in the general population, I think it's a really, really crucial issue that the HSE need to be focusing on.
And are you happy with how it went today, the reactions from your fellow councillors?
Yeah, well, look, this ultimately we got universal support around the county, and there isn't a family, I suppose, in the county that hasn't had some connection to either Alzheimer's or dementia. Really, it's about what the response is going to be from the HSE, and it's not just a HSE issue; it's a public and private issue. As we know, there are a number of private nursing homes in the county that are providing really, really good dementia-specific care. I think of Carragorn in my own corner of County Clare and Newmarket-on-Fergus, and I'm sure countless others around the county. I suppose how the HSE are going to develop the public capacity and how they're going to support the private sector really is the key issue here, but I was happy with the support we got in the chamber today.
You did get support today, but all you can really do is ask the HSE. Are you expecting any actual change or positive outcomes from this?
Well, look, of course, it's not the decision. It's not the decision of Clare County Council, but ultimately, I suppose the role of Clare County Council and the role of councillors is to be to govern at a local level and to advocate at a national level. I would be hopeful that the universal support of the councillors today would at least raise the issue, and that the councillors on the regional health forums also be able to bring it forward. It's not something that we can click our fingers and see happen overnight. But I suppose it's important to ensure that it's part of the development of strategies into the future, and that as we look to the population growth coming down the track, so the HSE are made aware of the need for us in County Clare.